I have experienced on a few occasions, I've experienced uncompassionate care from medical professionals. So I can recall a situation where I was in a hospital where my friend is a midwife, and I was in hospital for, let's say, just over a week. And during that week, I was telling friends that they're not giving me the pain relief on time. And I think at the time I was prescribed pain relief on an hourly basis. And I was explaining to my friends that they're taking very long. And my friend thought, because she worked in this hospital, she thought I was exaggerating. So she came after a shift to come and see me. And she counted 3 hours where I was waiting for pain relief to be administered by a nurse. And if I'm being prescribed pain relief hourly, that's because the pain is so bad. It's not a small drug. This is diamorphine. This is very strong stuff. And for me to be given that on an hourly basis is because the pain is unbearable. So then to be forced to wait 3 hours because I can't administer it myself. And when the nurse came over, there was no extenuating circumstance. It wasn't as if, I don't know, patient A had a heart attack and they were dealing with patient A. She came across, she was quite jovial and, oh, I just kind of misplaced your drug chart. And there was no sympathy, and I'm in excruciating pain. It's very difficult in those circumstances to not want to, in a sense, I would say almost lash out at the nursing staff, but I can't even do that because I'm in so much pain. And I also have to remember that I'm still in pain and I need the medical personnel. I don't want to, it's like, I don't know, I can't stick up for myself too much because then they see me as a difficult person, and with that, they can make the decision not to help me even further or make me wait longer because I'm rude or things of that nature. And that's really difficult. I mean, fortunately for me, because my friend was there and she witnessed it and she works in the hospital, she was able to then take it forward. And I guess as an independent party, it's just that she was there and witnessed it. But if she hadn't been there, what do I do? I mean, that had been going on throughout the period of the week. So it wasn't that she had misplaced my drug chart, because if that was the case, it would have been a one-off occasion. This is a constant thing. I'm requesting pain relief and I'm being told, oh, it's coming, oh, the nurse is coming, and the nurse doesn't arrive for 2, 3, 4 hours. It's cruel to see somebody in pain and leave them like that for no good reason. I've had, and I mean, that's just one example, but I've had so many different experiences of uncompassionate care, or where people just believe you to be suspicious. I find that happens a lot in A&E, where medical personnel may think, oh, you know, they've come again for some pain relief and so on and so forth. And I can understand, because the pain relief has side effects such as slowing down oxygen levels and making you really drowsy. I can understand the concern if it's genuine concern. But all of these things, I mean, the medication is given in accordance with my weight. My care plan would factor in if I was really, really struggling to take on the amount of pain relief that I was being given. So at the point of A&E, what I need is the pain relief, again, to avoid any further complications down the line, to avoid the crisis going on for longer than it needs to. Being given the pain relief that I require, that is adequate for the level of pain I'm in at the right time, is extremely helpful. I mean, I've participated in training sessions with doctors, training other doctors, and even haematologists would agree that it's not the job of the A&E doctor, the A&E nurse dealing with me, to diagnose me as a drug addict at that point. If I'm in pain, you have to believe me, you have to give me the pain relief. If it is that I'm reliant on these drugs and I'm coming in for a laugh, the haematology team that I'm under, they'll be able to identify that and address that accordingly. But chances are most sickle cell patients that you see on a day-to-day basis are not there for a laugh. There's 1,000,001 places I would rather be than in A&E requesting pain relief, you know? I have experienced having to kind of almost act out as though I'm in pain to make it believable for people. Personally, I actually think it's ridiculous that I have to do that. I mean, I have a very wide smile, and so sometimes I may smile and people say, oh, look at that big smile on your face, you're not in pain. I'm in pain. It's just that I've learned to deal with this pain since being very young. So I can, in some circumstances, smile through the pain. I shouldn't have to, I don't know, pour water on my face and mess up my hair and to make it look like I've been screaming and crying all night long because of pain that I'm in. I mean, I'm a human with autonomy over my body. If I am coming to A&E saying that I'm in pain, whether I come in a suit or in a tracksuit or in pajamas, it doesn't matter how I look, whether I've come with makeup on my face or no makeup whatsoever, I have autonomy over my body. You should believe what I'm saying. As I said, most people are really not coming to A&E or into hospital for a laugh. They're there because they are genuinely in pain. And again, the pain can be anywhere. So if I have a crisis in my arm, I can still walk. So just because I'm walking up and down the ward, that doesn't mean that I'm not in pain. It just means that the pain isn't in my leg. Being on a hospital ward can be quite depressing. There's nothing to look at. It's depending on the hospital you're in, there may not even be windows. There's no artwork. So walking up and down the ward is the only kind of entertainment, as it were, the only interaction with people that you kind of get. So just because I'm walking up and down or I have friends around and I'm laughing, it doesn't mean I'm in any less pain. I'm still in pain and I still need treatment. People don't, when you have a chronic condition that causes you so much pain, you kind of have to, it sounds really harsh, but you have to learn to live with it. And as a result of that, I can be in pain and appear as though I'm not. But if I am using my mouth to tell you that I'm in pain, I'm in pain. I would like to be approached and spoken to, and it sounds ridiculous when I say it out loud, but I would like to be approached and spoken to as a human being, as a normal human being who has a condition. Don't speak to me as though I am just the condition, or don't speak to me as though I'm a liar or as though I'm an actor, or just the way you would interact with other normal human beings. You wouldn't deal with somebody who has cancer, which again is pain that you cannot see. You wouldn't deal with somebody who has arthritis, which again is pain you cannot see, in a horrible or unsympathetic way. So similarly, don't treat me or other sickle cell patients in an unsympathetic or uncompassionate way. I can recall a time where I was being discharged from hospital and a nurse said to me, "Oh, well, you're going home now. Well, until next time." And it's just like, I'm not here for a joke. Don't see it as, "Oh, well, she's always here, so she'll be back." It's probably true, but it's not nice to hear. It doesn't fill me with the utmost confidence, because remember, when I'm being discharged from hospital, I have to go back and rebuild my life. I have to go back home. I'm on bed rest. I then have to go back into work my way back into being able to continue full-time work my way back into being able to continue university and studying for a master's, and work my way back into having a social life, work my way back into being able to go to family functions and things of that nature. So it doesn't end at the point of discharge, you know? So being told that, "Oh yeah, well, you'll be back soon," can be quite disheartening. Even if the chances of that being true are very significantly high based on my medical history, and you know, just deal with me as a normal person. You wouldn't say that to a cancer patient if they, I don't know, went into